Hello everyone, how are you? This is Dr. Kim. Today we have two panoramic radiographs taken 2 years apart. This is the first set of our first image when the patient was 10 years old. So take a moment to look for where the odontogenic keratocyst is located, and if you look closely in the areas of the root apices as well as the interdental distances, you should be able to find where that is. So take a moment to evaluate both upper as well as lower teeth, and hopefully by now most of you have identified where this lesion is. As I shared with you earlier, this patient is about 10 years old, and with that we're seeing erupted first molar in all quadrants, and the second molar is still in development. However, one thing you might have noticed is the distance between the second molar and the first molar over on this side, patient's left side, is significantly wider than the other side. So you may be wondering what's going on here. I think at first it might be difficult to realize where the lesion is, but having mentioned that, if you pay close attention, you're going to see this radiolucency between these two teeth. Even if you fail to see the radiolucency, I hope you saw the increased inner dental distance, which is important in this case. So now fast forward 2 years and the patient is 12 years of age, and we have another panoramic radiograph of this area. Right here. So 2 years, and now the patient is 12 years of age, and clearly there is a well-defined and corrugated radiolucency in the posterior mandible, and over the 2 years it has enlarged quite a bit, such that the height of the alveolar process or mandible has increased. Just look at the other side. That's the normal side, and this is obviously the abnormal side. Not only it has increased quite a bit, there is a thinning of the inferior cortex of the mandible. On this radiograph, I think it's very hard to discern the position of the mandibular canal, and at least over on here, I don't see any evidence of root resorption or displacement. However, number 18 has been displaced rather significantly, right? It was located about here 2 years ago, and now it's displaced distally as well as superiorly. Not only its displacement, it's also been rotated such that the occlusal surface or plane is now facing mesially, whereas before it was at least positioned somewhat in this like normal fashion, like upright fashion. What I found this radiograph interesting is that had I only seen this radiograph, okay, the second set of image, I would have probably considered dentigerous cyst as my #1 differential versus the odontogenic keratocyst, just because of its pericoronal radiolucency and the prevalence. Obviously, when I consider all of these factors, also keep in mind this patient is only 12 years of age, or at the time of first radiograph only 10 years of age. Now I think I would have strongly considered dentigerous cyst just based on this radiograph. But now that I have the benefit of having this original radiograph, I wouldn't have considered now dentigerous cyst because it's not directly involving the follicle of a tooth. Now looking at the second radiograph very carefully, you know that the dentigerous cyst should attach at the level of the CJ, and I think you can make an argument here that this radiolucency appears to end at the level of the crown rather than extending to the CEJ, and that's also the case here as well. The follicular space here is very tight, and you don't see radiolucency like extending into the CEJ. So that's another subtle feature that you can see to perhaps disfavor the diagnosis of dentigerous cyst. But again, if this is only thing I had, I think I would have still considered dentigerous cyst on my differential diagnosis. So this was biopsied, and biopsy result was OKC. I think a couple things that we can learn from here. Yes, OKC can occur in a very early age, as it did in this case. Not only that, you can kind of learn the expansion or the growth of the lesion over the period of 2 years. So that growth and the expansion rate is not going to be same from patient to patient, but I think at least from this case we have some idea of how fast or slow it's going to grow. But the one question that I have is, obviously I don't have the entire clinical information, why this was left to grow for 2 years before undergoing biopsy. Now it's so much bigger. In order to completely clean out this area, you run the risk of injuring the nerve, whereas if we did the biopsy 2 years ago, I mean, things are just a lot smaller, just a lot more manageable. Having said that, it does still appear to be relatively closer to the mandibular canal, but once again, it's small. I would think it's a lot manageable, but they left this to grow 2 more years. So I don't know the full clinical picture of what has happened since this panoramic radiograph. Anyway, I hope you found this video very educational and helpful. And as always, that's my goal is to educate you and share my experience as I also continue to learn as an oral radiologist here at the University of Nebraska. If you like the video, I do like to grow my channel. Please subscribe and hit the notification button so that you can be alerted every time I upload a video. And if you like the video, please hit the like button as well. Thank you very much, and I'll see you next time.